Taming the High Cost of College, Episode 102.
You have kids, they grow up, and before you know it, it's time to plan for college.
Where do you start?
How much is it going to cost?
Will you qualify for financial aid?
Should you be looking into scholarships?
When will you be able to retire?
What about student loans?
The list of questions is never ending. The good news is, all the answers are right here. Welcome to the Taming the High Cost of College podcast. Here is your host, certified financial planner, Brad Baldridge.
Hello and welcome to Taming the High Cost of College. I'm your host, Brad Baldridge. Today we have a great interview with Dr. Kimberly Sanders. She is a doctor of naturopathic medicine, and if you're not sure what that is, I know I wasn't, she will explain it in the interview. What I've learned in this interview is that there are a whole lot of careers out there that most people have never heard of, and there's new and emerging fields. So as an example, being a doctor of naturopathic medicine. It's different than being your traditional doctor, but you work in the healthcare industry alongside doctors, and it's a different path, and it may be right for some students where they do something slightly different than the full medical school route. Now, there's obviously a whole lot of different career paths out there and a whole lot of jobs out there that most people don't know exist, and I think that's a great opportunity for students to explore a little bit and learn what it is that they might be interested in and perhaps is on the new and cutting edge. So again, as an example, Kimberly is involved with naturopathic medicine, and there's only 8 or 10 colleges out there right now that train these types of doctors. So it's a growing, burgeoning field, and it's new, and I think we can find that in a lot of different industries and a lot of different professions. So if you're interested in naturopathic medicine, by all means, stay tuned. But I think there's a lot of lessons in here, even if you're not interested in naturopathic medicine. If your student is considering other directions, I think if you kind of pay attention and kind of hear how the world is kind of evolving and there's different specialties and different categories, I think it could be applied to any major, whether it's business or engineering or other avenues as well. As always, show notes are available at Taming the High Cost of College. And I appreciate you listening. Let's go ahead and jump into the interview. All right, today we're sitting down with Dr. Kimberly Sanders. She is a doctor of naturopathic medicine. She has a practice in Milford, Connecticut. Welcome, Kimberly.
Thank you, Brad. Thank you for having me.
I guess let's just start. Can you tell us a little bit about your path and how you came to be doing what you do?
Sure. So I am a naturopathic doctor, as you mentioned. So what that means is I practice naturopathic medicine, which we'll talk about more in a moment. But it's basically a system of medicine that focuses on prevention. And all the time growing up as a child, I had a multitude of health issues, ear infections and digestive concerns. And it was, my own parents, my own family bringing in the type of natural medicine and visiting chiropractors and having that exposure as a child to natural routes of healing and realizing that was what got me better. And that really made me decide to want to become a doctor, but specifically a naturopathic doctor. So that's where I ended up where I am today.
All right. So I guess why don't you start there then? What is the naturopathic medicine and how is it the same or different than what most of us are familiar with?
Sure. It's a great question. So naturopathic medicine is a system of primary medicine. So the doctors who graduate from a naturopathic medical college are primary care doctors in many states. But the difference is in the way that we approach disease. So there's a really strong focus on prevention rather than just waiting until somebody has an illness to treat that illness. There's a strong focus on preventing chronic disease. But if a patient does already have a disease, we are focusing on the underlying causes. What's going on in that patient's life that's causing the disease? Is there stress? Is there poor diet? Is there a lack of exercise or something going on at a genetic level? So we're really trying to figure out where is the disease coming from? And then we're using mostly natural medicine to address that condition. So even though naturopathic doctors do have prescription rights and can write prescriptions in many states, we usually try to use diet change, herbal medicine, nutritional supplementation first as a first line.
Okay. So then when you decided to study this, let's go back to when you were, say, a junior in high school.
Mm-hmm.
Is this a path you kind of knew then, or how did your path kind of unfold?
Yeah, so I know I had no idea about naturopathic medicine when I was in high school, but I did know I wanted to study medicine. So I had that in my mind when I was looking at colleges. I was very much focused on pre-med education, and I knew I wanted to go into medicine. I just didn't know what kind of medicine. So I did a lot of career fairs and those kinds of things, looking at all different medical fields, and nothing really quite felt right, but I knew that I wanted to do medicine. So I did apply as a pre-med student, and it wasn't until it was in my first year of college that I found the naturopathic medicine path, and it didn't change my path of study. I was still pre-med, and it just changed where I ended up. So so no, I didn't really have that in my mind right away as a junior, but I just knew I wanted to study medicine.
Okay. So then what is the path for naturopathic medicine as far as, obviously you get an undergrad, it sounds like, and then how does that work, and how is that similar or different than typical medical doctor?
Sure. So the training is actually very similar. You will, as a high school student, you would do some bachelor's training. So most of the incoming students, and I'm actually also a professor at a naturopathic medical college, so I teach in a medical program. So most of our incoming first year students do have a bachelor's degree in some kind of science, biology, chemistry. There is a pre-med requirement, but we also do have students with a bachelor's degree in other types of sciences who just did the prerequisites on the side. So you are required to have a bachelor's degree. It doesn't necessarily have to be a bachelor's degree in the science. Some students study psychology. We even have some business students that come in that's their bachelor's degree, but there is a set of prerequisites that you do need to have to get accepted to a naturopathic medical school.
Okay, and let me interrupt you, because I think that's key for some people to understand. So when you say a list of prerequisites, that's essentially a list of classes that they have to have taken as an undergrad. Can you give me some examples of what those might be?
Yeah, so there are a couple of biology requirements, usually 2 semesters of biology, and there's some wiggle room in the type of biology that you can choose. There is chemistry, so 2 classes of general chemistry, and then organic chemistry, so total of 4 chemistry classes. There's a requirement for a physics class. There's usually a requirement for one kind of psychology class, whether it's some kind of counseling or introduction to psych, something along those lines. And let's see, and then there sometimes there's a requirement for different types of humanities and English, sometimes a writing, and it can vary a little bit depending on which naturopathic medical school you're applying to, but that's typically the backbone is a few biology, few chemistry, physics, and sometimes a psychology, and then there can be a couple of other outliers depending on which medical college you're looking at.
Right. So I guess the point here is, as long as you've taken those required courses, it doesn't really matter what your major was?
Exactly. And actually, the naturopathic medical colleges find it really interesting if your major is something other than medicine, because it makes you stand out. You have some other way you might view the naturopathic medical training. But again, maybe 50% of the students do have their actual degree in a science, but many of them don't. But as long as you've taken those prereq classes, you can be accepted even if your bachelor's degree is in something totally different.
Okay. Sorry for the interruption, but I think I get a lot of questions along those lines as I'm working with families as far as what the path to, MD or grad school and various types are. So,
yeah.
All right. So then you take these courses, or you take an undergrad, and then you graduate and you make sure you have the prerequisites, and then what's next?
So then you go through the application process. There are 8 naturopathic medical college programs in the United States and Canada. So you would have your option of these 8 colleges. There are 6 of them in the United States, 2 of them in Canada. On the East Coast, the University of Bridgeport, which is where I teach, is the main college. There is a 9th program opening up in Maryland, but it's not in full operation just yet. There's colleges in Arizona, Seattle, Washington State, California, Chicago. So there's a few, all scattered around. And, really the student would just look and see which of those colleges really calls to them, whether it's location or whether it's a particular specialty that maybe one of the colleges has over another. And then you would undergo an application and interview process very similar to regular medical school. You would be called for an interview, do a campus tour, and then you would submit your application, your essay, and eventually find out about acceptance.
So what are you signing up for as far as this 2-year program or 4 years, or how does that?
So it's very typical to the regular conventional medical school. It's a 4-year program. So you're, again, a lot like the regular medical school, the first 2 years is very heavy in basic sciences. You're really just learning how the body works. You're learning about disease. And it's really the second the third and fourth year that separate a naturopathic medical college from a conventional medical college, where you're not only learning about prescriptions, but you're learning now, well, how do I treat these diseases with things like herbal medicine, with diet, with exercise. And there is a clinical part where you're actually in the clinic seeing real life patients in those third and fourth years and getting to apply this knowledge in a real life scenario on true patients.
Okay, so then it's a 4-year undergrad and then 4 years after that, and then
Yep.
and then you're graduated and you're done, or is there?
Yeah, so naturopathic doctors are not required to do any residency training. So the majority of naturopathic doctors, when they've graduated that 4-year naturopathic program with their naturopathic doctor degree, many of them are fully prepared to open a practice, start practicing. But there are residency positions available for students, or for at that point, doctors, young doctors that feel like they need additional training. They are available, and I myself did a residency. So that is an option for some young doctors who feel like they want additional training, but it's not required.
All right. So then you go through that process. What types of careers, or where do you typically find work? Is it the larger healthcare? Is it solo practices? Is it all of the above? I mean,
yeah, so it's really all of the above. This is a really emerging field. The career outlook is wonderful. Naturopathic medicine is only growing. So it's really an emerging profession. So there are a number of paths that naturopathic doctors can take. I would say the majority of naturopathic doctors wind up going into private practice. And that's really what we're trained, best to do, is to become primary care doctors. So whether they join up a practice with another doctor or open their very own practice, that's what most do. But there are teaching opportunities. I myself practice, but I'm also a professor. So I teach at a naturopathic college, and that is one avenue that some naturopathic doctors go down. Other naturopathic doctors become consults at labs. So they are hired by labs, and they design lab testing, they interpret labs, and so that's one option. Some naturopathic doctors go purely into research. So there are some associated with NYU, for example, and that's really all they do is research in the field of naturopathic medicine. And others go to develop products, supplements, for example, develop and make companies that sell different types of natural products. Other people who go into lecturing and writing. So there really are a number of career paths, but I would say private practice is the majority of what most of our graduates wind up doing.
Okay, so then what path did you choose? You said you're teaching and you have a private practice? Or?
Yeah, so I've done a hybrid of the two. So I am a full-time professor at the University of Bridgeport. So my primary profession is the teaching in the naturopathic college, but I do also practice. I have a private practice as well. So there's also that opportunity that you can have a hybrid profession where you do a multitude of different things with your degree.
Right. So I guess I don't know much about this. I don't know how many of these types of doctors exist, but what kind of acceptance is out there? I mean, as an example, insurances. Do insurances tend to cover?
So that depends on the state. So in the state of Connecticut, where I practice and where the University of Bridgeport is, there is insurance coverage. So I am able to accept most of the major insurance companies like Anthem Blue Cross, for example, a few of the major ones. In other states, there's not insurance coverage and people do have to pay out of pocket, but that's becoming more and more available, insurance coverage.
Right. And then you mentioned you would be a primary care potentially?
Yes. In some states, you're considered a specialist. Again, here in Connecticut, we're considered specialists, but in many of the states surrounding Connecticut, Vermont, New Hampshire, Maine, you're considered a primary care. So you can be someone's doctor from the time they're a child all the way until they're, an adult, and really be their first line of who they come to when they have an ear infection or a cold or, really any of those things we go to the doctor for on a regular basis.
Right. And then it's kind of up to this particular doctor to decide if it's a traditional, as an example, an ear infection might warrant antibiotics. So you could prescribe those?
Yes, in those states you are able to prescribe. Vermont, for example, has a very large scope where certainly antibiotics and many other types of prescription drugs are part of what a naturopathic doctor has the option to prescribe. In the state like Connecticut, where we don't have those prescription rights, we are certainly able to refer and trained when is it appropriate to refer if that ear infection is well beyond the ability to safely use a natural medicine or an herbal medicine. We most certainly are trained to refer for antibiotic prescription.
Okay. And then you guys have further subspecialties and that kind of thing? Like, would a naturopathic doctor specialize perhaps in, like diabetes or gastrointestinal issues or something like that? Or
yes, that is possible. There is, especially now, there are associations for subspecialties. So, for example, there is a subspecialty for cancer care, where you are a naturopathic doctor and you can choose to follow a specialized track after graduation, though these are things you would do postgraduate, where you would then specialize in cancer or specialize in pediatrics, for example. Though even if you don't follow one of those postgraduate tracks, you can certainly just have an area of focus. For example, diabetes, there are certain naturopathic doctors who really have dedicated their practice to things like diabetes without any additional education being required of them.
Right. So a little bit of a challenge, I think, that out there for some people is, again, for a lot of people out there, the herbal side of things is kind of questionable as far as, I think there's a lot of people out there with zero training and zero or very minimal training that are saying, well, you just take this magical herb and because it's not medicine, they can get away with recommending or diagnosing or...
Yeah.
So where does your type of training, et cetera, fit in with the kind of what else is out there?
Right. And I think exactly what you're bringing up, it brings up why there's a need for naturopathic medicine, because you can go to any health food store and ask the person behind the counter who does not have training or a license questions about herbal medicines. And just because something is natural doesn't mean that it's safe. So it's very important that when people go and choose to take something natural, that they have that in mind and that they've consulted with somebody who's licensed and trained and has read the evidence and knows what the evidence says about not only the safety of the herbs themselves, but also how they interact with people's medication. So it's very important that more naturopathic doctors come into the workforce so that there's accessibility for people to be able to consult with a naturopathic doctor so that they can start taking something natural that's safe. But that's the exact concern, is that these natural supplements are widely available and people can simply pull them off of the shelf without consulting with somebody who's licensed and trained and the expert in these medicines, as we are, naturopathic doctors are.
Right. So then a lot of your training then, as I look at it, I would assume that there's studies that they do on an herb that would be very similar to a study they would do on a drug to see if it's actually effective, blind tests and that kind of stuff.
Yes.
And that's the type of thing that the researching side of your profession might be doing?
Correct. Yes, you can do a clinical trial on something like turmeric, which is a spice, the same way you can do a clinical trial on aspirin, for example. And that data, that literature is out there, and there are naturopathic doctors who are performing those kinds of trials.
Okay. So let's, I guess, back up again and talk a little bit more about how this might impact a family with high school students. So if we were looking to go down this path, and because it's a relatively new profession, I doubt it shows up in a lot of the literature, et cetera, the career guides and that kind of thing. So I guess, first of all, what kind of income or pay, or how does that generally work out?
Sure. So if you were to, go onto one of these salary calculators, the standard response that you'll get is around $80,000 per year as a typical salary, average salary for the naturopathic doctor. Again, most naturopathic doctors are going into private practice. There are opportunities for a naturopathic doctor to become a salaried employee of a particular institution or a hospital, in which case the pay is more secure. But most naturopathic doctors are going to be business people, entrepreneurs opening their own practice. And and at least in my experience, the naturopathic doctors I know, the potential to go above that 80,000 is there if a person put it what they do. They know how to manage the business side. They have good business sense. And those are things you will get training for in the college. And achieving a salary higher, much higher than the 80,000, totally possible. But you may also fall below it if, again, you're opening a practice, but you're not ambitious about making that practice set off. So a lot of that salary is in your own control, just as any kind of business entrepreneurship is. But there are secure positions, like in the education field, like being hired by a hospital, which you would be able to get a set salary that stays. And again, that number is in that 80,000 average range.
Okay. And then do naturopathic and normal doctors partner, or? Yeah,
more and more that is becoming very well accepted. I would say in my experience with my practice, I have faced very little opposition with medical doctors or osteopathic doctors accepting and actually referring to me. There's actually even a local pediatrician in my town who sends me, at this point, more patients than I can even handle, because that collaborative relationship is there. And you'll always have medical doctors that are a little weary of it, but for the most part, that's changing, and there's a lot of collaboration that goes between naturopathic and medical doctors now. And for example, even here at the University of Bridgeport, our clinic was contacted by a pediatric office in Connecticut and asked to have some of our students actually do a rotation in their office. So we do have naturopathic students now in this conventional medical doctor pediatric practice performing naturopathic medicine there.
Right, and I guess that's where I was going, is you might find, if you go to a large, say, pediatrics office now, there's obviously some doctors, but there's also nurse practitioners or PAs or other specialists of various types there. So a naturopathic doctor might be one more staff person at a larger clinic of some sort?
Yes, and actually one of our more popular residency positions is housed at the Cancer Treatment Centers of America. I'm not sure if you're familiar with that. Sometimes you see the commercials on television. It's a large oncology hospital that features, chemotherapy, radiation, surgery, but they actually have a naturopathic department. So that's just another example of the integration that's occurring now, and I think will only get stronger as time goes on.
Right. So if I've got a junior in my household that's looking at maybe MD, or again, I guess this is ND, like Nancy David, correct?
Yes.
If this might be a path they're interested in, how competitive would it be? And are there any direct admit systems out there right now, or how? I guess what I'm driving at is I have a lot of parents there where they've got a student that wants to be a doctor, but maybe their grades aren't that strong, and the reality of it is that some of these paths are, 800 will apply, 20 will be accepted. When you hear about those types of odds, it's like, okay, well, then you really have to step it up in your undergrad and, do things the right way. Is that similarly competitive?
It's competitive. I know at the University of Bridgeport, we require a 3.0 GPA undergraduate to, apply and considered for exception at the University of Bridgeport. So, that's a 3.0 is, for an undergraduate level, can certainly be restricting for certain students. So if a student in high school, a junior in high school, is interested in medicine, but their grades are struggling, it's best to start early. Start getting your resources in line. Consider, really when you enter college, getting some help and making sure that you can get those grades up and start either meeting with tutors or discussing how you can utilize the resources available to you, because it is a competitive program. We will have more students apply than accepted for sure. So it's important to consider it like the same as any other medical college application process, where you want to show strong evidence of extracurriculars, strong evidence of really dedicating yourself to your studies. So that's something that, hey, if you're starting early, junior in college, and you're interested in medicine and possibly this path, just get started early on trying to make those positive changes.
Right. And again, I don't know how involved you get into admissions, but when you're evaluating applicants, obviously you look at their grades in their college so far. Do you also require some sort of test? The MCAT or one of those?
That's a great question. Not at this time. So in order to enter naturopathic medical school, there is no requirement for the MCAT or the is it the
GRE?
The GRE? Yeah, sorry. Yeah, so there is no requirement for that at this time.
All right. And then do you also, you mentioned extracurriculars. Are you referring to just being active, or are you referring to specific medical type extracurriculars?
They don't have to be specific medical. I think we're looking for people who are eager to be involved in their community in whatever way that, they're drawn to, whether it's theater or public service, something that shows that in addition to handling your studies, you're also dedicated to your local community, in your college community or the wider community. We're just looking for that kind of feature as well in a student.
And then is there an interview process typically as well?
Yes, there is. So upon application, you would be called for an interview, and you would come on campus and usually do a campus tour, possibly even sit in on classes and have an opportunity to see what it's like the day of a student and ask questions and meet some of the faculty.
So, and talking to some other admissions people, I mean, one of the primary purposes of the interview is to kind of learn more about the student beyond the statistics, their grades and test scores and that kind of stuff. And they're looking at things like what type of bedside manner you might be able to have, et cetera, et cetera. Is that the purpose for you guys as well?
Absolutely, absolutely. Especially in the naturopathic medical field, we really want to make sure that it's a person who will have that bedside manner, who will have the critical thinking, because we do really value the relationship that we develop with our patients. As naturopathic doctors, we spend a lot more time with our patient than the medical doctor. Our first appointments with the patient are sometimes an hour and a half long. We're really sitting there and trying to dig deep into that person. So we want to make sure there's a level of professionalism, maturity, and also, that bedside manner and that passion for the field. And we also would love to know a little bit about why the person chose this path, or maybe they don't know much about it, but we're sitting with the student and trying to understand that, how they got here. Why are you interested in naturopathic medicine? What are your expectations of this program, and learn a little bit more about their thoughts behind it.
And then I guess the next area would be a little bit on the finances. So obviously financial aid is available. It's a program like any other grad school.
Yep.
What is the typical pricing? Is it as expensive as medical school often is, or?
It's a little bit less than typical medical school. I believe the last numbers that I got, about 20,000, but let me see. I don't know if we have time for a little pause. I can actually pull it up here.
Well, yeah, why don't we look that up? We'll put that in the show notes then, as far as, some of the statistics that you have. And
perfect. But
great.
Like you said, financial aid is available, and one of the best things about the way the loan situation works now is that naturopathic doctors are eligible for what's called income-based loan repayment. I don't know if that's something you've touched on in shows before, but essentially your student loan debt, when it's time to repay it, you're able to apply for the ability to pay no more than 10 to 15% of your income back towards your loans. So you would have that wiggle room.
Right. So it makes it a little easier for you to start a practice, or
it does.
Take some sort of lower paying residency or something to get started.
Correct. Yes.
Okay. Well, I think we learned a ton about your up and coming profession here. And is there anything else you'd like to add?
No, that's it. I think also, even as in addition to being students, thinking about using naturopathic medicine, even for yourself, if you are as a student having trouble, staying awake, focusing, even considering a naturopathic consult yourself. So you're on the other side of it. See what it's like to be a patient. It's a really great way to learn the profession, is to see if you can sit with a naturopathic doctor and see what they have to say. I think that's a great way. But no, that's pretty much it.
So in your professional opinion, is Red Bull a naturopathic method to stay awake?
I think there is maybe some better choices we could come up with than that. Actually, coffee might actually be a little safer than that.
All right. Well, again, I appreciate it. If people want to learn more and get in contact with you, what's the name of your college again? So
it's the University of Bridgeport, and you can certainly contact me through the University of Bridgeport or through my Facebook page. I believe the link will be posted on the show notes. It's
yes.
Facebook.com/Dr. Kim Sanders, ND.
All right. Yeah. So if they want to get you directly, and they can also just go to the University of Bridgeport to learn more about your program, if they want to, again, if that's something they want to pursue.
Yeah.
But again, I appreciate it, and we will stay in touch.
Great. Thank you very much.
Thank you. All right, that was a great interview with Dr. Sanders. Hopefully you learned a little bit about naturopathic medicine, as well as perhaps just general college planning and career options out there. As always, show notes are available at tamingthehighcostofcollege.com/102 for the 102nd episode. And if you have any comments, questions, or concerns, feel free to give us a call or contact us through our website. We appreciate any feedback, and we can help you in your endeavors if you have some questions. So the phone numbers and email contacts are available at our website at tamingthehighcostofcollege.com. And I encourage you to reach out if you need anything or I can help in any way. That's all we have for today. I look forward to talking to you next week.
Thank you for listening to the Taming the High Cost of College podcast. Now it's time for you to take action. Head to tamingthehighcostofcollege.com for show notes, bonus content, and to leave feedback for Brad. The next step on your college journey starts now.
Brad Baldridge is a registered representative of Cambridge Investment Research and an investment advisor representative of Cambridge Investment Research Advisors, a registered investment advisor. Securities are offered through Cambridge Investment Research Incorporated, a broker-dealer and member of FINRA and SIPC. Brad owns two companies, Baldridge Wealth Management and Baldridge College Solutions. The Baldridge companies are not affiliated with Cambridge Investment Research.